Good afternoon and welcome. I'm your host, hostess, Dr. Janet Seabrook, and you're listening and viewing Your Health Matters. The reason why I'm smiling, I'm so excited today, is because I'm with Miss Freida, and we're at Faith Farm. So everybody give a shout out and a hand clap.
We are out here in the open.
Yes, we are out here in the open, enjoying the elements of Faith Farm. I just got a view of a duck and a goose that had babies. Now we got these duck, goose, and babies running around here. You get with Miss Freida, find out when you can come and see these goose duck babies. Goose duck babies, that's what I'm going to call them. So Miss Freida and I have been knowing each other for a long time. And way back when this was just a thought, an idea on some paper and some seed, placing a few seeds in the ground, and to what it has grown to now. And I think about the conversations we also had in the past about, what could, potentially this look like. Food is medicine, research projects, and all of these things. So I'm just so excited to be here. And so let's talk a little bit about Faith Farms and the work that you're doing here, what current projects you're working on, and what the future looks like for Faith Farms. And before we get finished, I like to marry all that together with how what you're doing ties into people's health.
Absolutely. So thank you, first of all, for having me, Dr. Seabrook, out here in the open with the goose sticks. It's a beautiful day.
It is.
And we're sitting back here in front of our mustard greens. Our mustard greens that are just, fabulous. That, God grows things that we never know how it's going to grow, what season's going to happen, or how it's going to happen. But this season seems to be a good one already, even with all the weird weather we've been having.
Yes.
So conversations years ago, we were talking about food as medicine.
Yes.
And years ago, and even by being a retired nurse, didn't know what it meant back then. I know it meant food is medicine. I mean, I know oregano was a natural antifungal, and thyme is a natural antifungal, and great for your respiratory system. I knew all these things, but I didn't know what actually doing a food is medicine initiative meant, per se, for the participants and for my learning experience. I mean, even though I'm a nurse, I've been learning things about food as medicine since I've been at this food as medicine project. At that time, it was just something that we had in our heart for our community, because we love this community so much. Gary is the main one, but all of Northwest Indiana.
Yeah.
We love our community, and we love for me as participants, but for you as patients. But we love the people around here, and we're wondering about a way to perhaps reverse some health disparities.
Yes.
Maybe we can do a little bit, but it's grown into something we could not imagine.
Right.
So we're going to from the testimonies of our participants, from the doctors sending over participants to be in the program, from the farm going even, because you've been here. The farm wasn't like this.
No.
Over the years, we had our little 3 little beds over there, but it wasn't like it is now.
So let's go back a little bit and kind of develop this, because I can remember sharing with you that when I would actively see patients, having conversations with them about their hypertension and their diabetes, and trying to create healthy recipes for them to control their diabetes and hypertension, by also reducing their sodium intake and just the whole 9 yards. And so I started doing some tweaking to patients' recipes that they would bring to me. And that, over time, came to this collection of recipes, right, that I then took and put together in a recipe book. Not a cookbook, recipes. Because I'm trying to teach people how to eat healthier by cooking their own recipes, taking that recipe that's in that book and making it their own. But I could also remember, before you and I having that conversation, having my own fruits and vegetables at home, and the lettuce would be too much, the cabbage would be too much for our entire family to eat. And so when patients would complain about vegetables are so expensive, I started leaving bowls of them out in the foyer, in the waiting room, in the office, and I would say, please take, make a salad tonight, take have lettuce, take some cucumbers, and take a tomato or two, and make a salad for your family tonight. Don't have dressing, you don't need it. You can make your own dressing.
Yeah.
You have a little olive oil, and add the
vinaigrette.
right.
Yeah.
And make your own vinaigrette. So we've been having these conversations
We
a long
have.
time.
We
And
have.
so we went from, doing that from my things that I had to offer in my garden to then it's like State Farms has all of this out here. Dr. Seabrook can kind of lay back in the cut and just write the prescriptions for the food and medicine program.
Yes.
And so tell us a little bit about how that was designed.
So when we first got a grant, the first grant was NIFA, Prescription Provision Program, through HealthNet. When we got that grant, we had a different director. We started off with a different director, but she was in school and she had some health issues going on. When I took over, I thought to myself, how can we write this in such a way where we're doing helping the most?
Right.
So then I decided, well, let's do a script, a food is medicine script. But not only let's do a food is medicine script, when we're teaching about the diet, let's teach it under the umbrella. You know there's low cholesterol, low sodium, low carb. Let's do the whole umbrella at once. So when we first started out, we were just doing the meals. So it was for coronary artery disease. It was Indiana Department of Health. We decided the meals need to be not only meals, but they need to be culturally relevant meals.
Yes.
That's what's missing. When you have, we're not putting down any particular place, but when you have the meals, they're like just sandwiches and things like that. But we want all cultures to be involved. Particularly, we look around here, our demographic people love collard greens and things of that nature. But we wanted to have healthy collard greens.
Correct.
So when we started with the culturally relevant, heart-healthy meals, we went with the chef. I wrote the footprint. Now, I did write the footprint of the program. It's a little bit different from most of the food medicine programs all over the country because most of them just give you a voucher and you go to your grocery store and get some vegetables. Well, with this one, we not only want to have the culturally relevant, heart-healthy meals, but we also wanted to have education involved. Like you were saying, you were tweaking the recipes. We want to also be able to show them the recipes where they can do this at home. Right. We did a lot of research with Indiana University Northwest. We had some interns out here. And a lot of the people that we talked to, we asked some of the people that were doing it when we did our CSA boxes, would you join a program like this? People that have diagnoses of diabetes, heart disease, and so on and so forth. They said they would. We don't know how to cook half this stuff. We don't know how to cook it. We don't know how to cook it in a way where we're going to want to eat it.
Right.
And that's why we went with the culturally relevant, heart-healthy meals. And the recipes where the chef would actually put in herbs that would take the place of some sodiums and things of that nature, so everything would taste good. So when we wrote the footprint, I wrote it in that way. Script first. Right. If you take the script to your doctor, or the doctor's office could have some scripts there. And the script focus was telling the doctor exactly what it was. Yes. And no cost to the participants. For 6 months, they'll receive culturally relevant, heart-healthy meals, low carb, low sodium, low sugar.
So I just got to slow down and stop right there. Our doctors and nurse practitioners love that program. When they would run out of prescription pads, they were like, can you call Miss Freida and get us some more prescription pads? I can remember having you on our virtual meeting and explaining the program to them.
Was really
they were so excited, and the minute they would run out of scripts, they were like, can somebody call Miss Freida and get us some more prescriptions? I said, sure, no problem.
And I can't
reach out to you, and you'll say, I'm on my way.
I'm on my way.
And you're like, which location? I'm like, let's take it to one, and we'll have somebody else distribute them to the other location. Yeah. And they love that program. And I see a lot of similarities to, the recipe book that I have and the Food is Medicine program by you bringing in that chef and actually showing them the vegetables that they traditionally have cooked another way, or introducing them to new vegetables that they would walk past in the grocery store because they didn't know what they were and they didn't know how they would taste. Right. Exactly. And so finding ways to complement as well as season your vegetables more naturally. So, getting away from those collard greens steeped down in pork fat, balls, and all of that.
And smoke. Did she look back at
it? Yes, she did.
The smoked turkey is one of my worst things that I do not use smoked turkey. And I keep saying, I don't want the meat industry to sue me, but it's full of nitrates and things.
Which acts up on the gout and causes other issues. Now, if you have to have turkey, then use a piece of fresh turkey.
Fresh chicken.
Yeah, or fresh. If you want to have that flavor, that meat. Use some vegetable broth. You know, yeah.
And it's fresh turkey wings. So use the fresh turkey. Smoke them yourself. Smoke it
another way, because then you know what's in it and what you season it with. So there are alternatives.
Yes, and that's what's been so wonderful. That as we go along, we're learning more. Even we, who have a medical background, who worked in the hospital, are learning more and more about the things that we can do and the things that you can do as small changes. I keep telling people, look, we don't expect you. Yeah, we don't expect you. If you have your piece of birthday cake, just have your piece of birthday cake.
Right, not the whole cake.
Right. Just small changes. If you just make small changes to your diet once a month or every week. Like we have a participant that I would never forget, because a lot of our participants just come and talk to them like my family. And he said that when he went to the nutrition education class, he started reading the labels. She taught them to read the labels. Yes. The 5 grams of is 1 teaspoon of sugar and the carbs and things like that. But he said that he would eat a bag of potato chips.
Not the 13 chips.
When he started reading the label, from the education class, he started dividing them into in each plastic bag, he put a certain amount of chips in there.
And that was his serving.
That was his serving.
So he still satisfied his cravings,
but he did not overdo. He wasn't overdoing it. Just like with the my plate, when we were teaching them about, I love fruit just like you, but fruit still has sugar. It's simple sugar. They break down in your body differently, but it still has sugar. So you can't eat 9 apples in a day and 6 tangerines and 6 peaches. You have to eat even a banana. I had a banana in a serving. So when they started learning about the servings, and they started learning about it, and they just, it's broken down to a way like you do. You break it down. Whereas it's not, it's just simple. Break it down.
So can we talk about a little bit about obesity and how we got where we are now?
Oh, yeah.
And how, I don't know about you, but I remember growing up when plates were this big. Plates were 6 to 8 inches. That was a good sized plate, a dinner plate or paper plate.
Yeah.
Plates went 8 inches, then a 10 inches. Now the plates are 12 inches. 12 inches. That is huge. And as human beings, we like to fill voids. We don't like to see empty spaces. So if you have a 6-inch plate and you fill that plate up, your brain is telling you you're satisfied because you ate a plate full of food. But when you keep increasing the plate, you're increasing the amount of food.
I don't want to leave nothing behind. I don't want to throw nothing away.
Most people raised to not waste things, to not waste, especially food, because it costs so much. And so we've grown these plates. We supersized our meals out in restaurants, and we ended up supersizing ourselves.
Correct.
So that's how we got here.
That's how we got here. And then we love good old soul food. Everybody loves good old soul food.
And there's nothing wrong with it.
There's nothing wrong with it.
But we can fix it.
But we have to be able to eat it we have to be able to cook it in a different way and only eat a certain amount in moderation.
In moderation.
So the meals when they get their meals, the potatoes only this size. So some of our participants have started, they use that as their whole meal. But as they went along and they started listening to the nutrition education and cutting down the portion sizes and so on and so forth, some of them now say, I eat a certain amount of it and I freeze it for the next meal. And think so people are learning. It's all about education. I have, like I said, to educate myself. I come to her nutrition education class and I was like, oh yeah, I remember that from the hospital, but it's been, when you don't use it, you lose it. Right. So I think it's all about education. I think it's so fantastic that we're able to educate our community with just small changes. That thing that they had when I came and spoke at when they did she cooked at Community Health Centers a few months ago. That was really cool. Yes. Making your own bowls. She was using. Yeah, I love cauliflower rice, but she was using cauliflower rice and all these kind of things like that. You can make changes. My husband at first he turned his nose up at the cauliflower rice, but I said, this is what we're getting. All right. But now he eats it. He loves it. I love just little changes. And we can make little changes in our diet. That helps us to be more healthy. We have people that lost up to 100 pounds in this program. We had a lady, she lost 105 pounds. Some of them lost 20 or 30 pounds. Now, we're not saying everybody needs to lose weight, but the changes also help with your blood pressure. Exactly. They also help with your medication reduction. Mm-hmm. Doctors have been reducing medication. And we work alongside the physicians. Like I said, we do nothing medical here. We do nothing medical, just teach about diet and didn't that we ate Joe movies. That's another thing we added.
So can we transition to, since you've mentioned the word education several times, how does this program impact the youth of our community?
Oh, yes. So now you're talking about our next urban ag generation.
Yes.
We are in the midst of that program right now. This is our 7th year. This is our 7th year.
Really?
We've been 7 years. It started with me driving the church van to Thea Bowman and picking up kids and bringing them here and teaching them about the animals, about the farm, about everything that goes on here. But now we're in year 7. Probably about year 3 or 4, we wrote a whole curriculum.
Really?
Yes. It was from through Urban Growers here. It was from us. We wrote the curriculum. And then we had a PhD. She's a PhD in education. We had her organize and analyze the curriculum. So we would put that in there and we would teach the children through that curriculum. So every Saturday, starting in March, they come out every Saturday and they learn that curriculum. Totally volunteer. They come out and they learn that curriculum. They learn about growing the soil. They learn about the different kind of plants. They learned about how you can grow at home. They learned about the what's in the soil, the nitrogen and the vitamin D and all those kind of things in the soil. They learned about composting. They learned about all those kind of things for 8 weeks. And then starting in June, they'll be here on Monday, Wednesday, and Friday. They'll get paid $15 an hour.
Oh, wonderful.
So they'll still be working out on the farm, learning about growing and things like that. They help plant some of these things out here too. I think they get the potato bags as well. They'll be still learning, but they'll be also learning about having your own money, entrepreneurship,
Right.
about fiscal responsibility. Every Friday we have a different speaker come in and speak to them. Arts, Chase Bank, Chief of Police, the fire department. We have local representatives like Reagan has came and spoke to them. So they learn about all that and they get paid while they learn it.
But I think that it's so innovative because the children are, it's a different environment.
Yes.
Even though they're learning, it's done in a fun way where they don't even realize they're learning. And the rooster is over there cutting up.
Yes,
he wants
yes,
to validate.
that time of day.
He wants to validate
It's
to
that
be a
time of day.
tree on the farm here. We got a
And-
rooster over here that's crowing like I don't know
And
what.
he's like, why you all over there? You don't have no food or nothing to give me some food.
Let me, before we wrap this up, because you and I did a class together, didn't we?
Yeah.
At the Purdue Extension.
Yeah, that was years ago.
Yes, it was.
Oh, yeah.
But they talked about soil amendment and raised beds versus
Yeah.
growing in the ground. So I'm curious, how did you all make sure that this soil was safe? Did you test it?
We tested.
Okay.
We
all right.
tested more than once a year.
Okay.
Because if you look over, we are one of our pillars is environmental as well.
Yeah.
But if you look over there, you have U.S. Steel.
Mm-hmm.
U.S. Steel. So we soil test every year.
Not just U.S. Steel, the train is right over there with their
Right.
diesel
And
fuel.
then so
whatever they're
everything
carrying
runoff
on it,
and
right.
storm
Exactly.
water runoff and things like that. So we test every year. We test the water as well.
Okay.
So we do that every year just to make sure that we're growing safely. Because what's in that soil is what's in your food.
Uh-huh.
So we
And
wanna
that's
make
why I
sure.
was so curious because I do raised beds in my home. I have a raised bed. And I think you had a raised bed container out there.
We do have a raised bed container, but also up under the soil is also compost. So we didn't grow that directly into the ground. We did layers and layers of compost before we grew them. That was from Will Allen, the godfather of urban farming. He was from Wisconsin. He came out here and showed us about the compost. You can grow anywhere. You grow that fab out there. As long as you have layers and layers of compost that you're growing on top of.
Yeah, I've seen people just take cardboard,
Yeah.
lay it on
We
top
do
of
that
some
too.
rocks,
We use that
and
too.
put a little, something to contain the soil, and then they put the bananas and fruit, whatever compost material, and leaves and what grass clippings, and next thing you know, they put the dirt on top, and then they're planting in it. So we have to have a part two, you all. So we have to come back to the farm instead of sitting. Maybe Miss Freida and I could walk around, and we could talk about the chickens and the other animals, and also cooking. We're not gonna cook the animals. We're not
But
cooking
maybe
animals.
we can bring some. I have all those camping stoves back there. We'd be out here cooking and
Yeah, we
on the
can
farm.
cook some of the vegetables
Yeah.
and things like that, but definitely, give the audience a tour of
Yes,
these farms,
absolutely.
and they can see the types of vegetables and also the crops that are here, as well as the animals
Yes.
that
See
are
these
here.
good old mustard greens back here, you all.
Yeah, I'm real excited. So again, thank you, Miss Freida.
Thank you for having me back.
Oh, you're very welcome. So you're number 2. You've been the second person that
I'm number 2. I will take it.
We had Pastor Dexter.
I know Pastor Dexter
from
very
Flourish, and I think
he just called me before I came out here. The doctor Dex, that's right. He was talking about the Thanksgiving giveaway. All right.
And maybe in 6 months, we have a show with all of my first guests on there. We can have some conversation about everybody's accomplishments and achievements that have happened since the first show. So
I just want to mention, I know we have to wrap up. I just want to mention one thing that's important that we did this year. That was the urban farm, the micro-urban farm bill with Senator Mark Spencer. That's now a law.
Yes.
So I want all local growers to know at some point we're going to have to get this study done because Gary is the pilot. So we want to show them what we got. In other words, I'm talking to all local growers. I'm not talking about just Faith Farms, but we need to be able to show them what we got so we can have that feasibility study in. So we can show them that we grow around here too. And we need these farms. We need these kind of spaces.
No, you're exactly right.
And so that's all I want to mention. And thank you guys for having me.
How do we find you?
So tell us a little bit about how we find you. You know, what's your website,
how do you find
email, whatever it is. How do
people know how to find me? No. We are at 656 Carolina Street in Gary, Indiana. Telephone number is 219-880-0850. We welcome volunteers. We also have Faith CDC. Our Facebook page is Faith CDC. And then we have the website, www.faithgary.org.
Thank you all so much. And just before we wrap up, don't forget September 29th, Saturday, September 29th, Community HealthNet Annual Breast Cancer Walk out in Marquette. The registration at 9, the walk starts at 10. For more information, you can go to our website. You can call 219-880-1190, 219-880-1190. Ask for the outreach department. They can either email you a packet or drop off packets to your office or location. Thank you again for tuning in. And remember, your health matters.